Welcome. My name is Nina Justiniano. I'm the Director of Nursing at TIA Allied Health. This is Mrs. Maneed Simon, RN, Nurse Practitioner. We're going to demonstrate the partial bed bath, which is one of the 22 skills necessary for you to pass your CNA license. We're using the clinical skill list checklist. We're going to follow this very closely because this is the requirement for the state. Okay? Now, some of the supplies that we need, cameraman, we need a basin, a washcloth, 2 towels, a gown, water, soap, and lotion. Okay. Mrs. Simon now is going to knock on the door, come in, and introduce herself.
Good morning, Mrs. John. My name is Maneed. I'm going to be your CNA today. How was your day?
Fine.
I'm going to provide you a partial bed bath. Is that okay?
Yes, it is. Okay. Now, she's going to get a basin of warm water. Okay. And now she's going to check the patient's ID. Hand wash required.
Hand wash required. I just washed my hand.
Exactly. She checked the patient's ID. All right.
Mrs. John.
Mrs. John. Now she's going to get some. She's going to lock the bed to provide safety and pull her curtain to provide privacy, which is required in all health institutions, hospitals, and nursing homes have privacy curtains. So we must provide privacy.
No gloves.
No gloves is required for this skill. For this skill, we're using the 4-corner technique. This is your washcloth. We're going to fold it in half, and then we're going to fold it in half again, which is going to provide us with 4 surfaces to be able to give our residents the partial bed bath. First thing is done is she's going to wash the resident's face. There's no soap on the face. She checked it. Checking the water for temperature. It's fine. Next, she's going to provide a nice towel underneath her head.
I'm going to lift up your head. I'll place a towel there for you. Provide protection for the bed.
Cleansing the eyes by using a soap-free washcloth, wiping the eyes from inside the corner to the outside corner. No soap. Wash and rinse. She's going to walk around the bed and do the other eye, which is wash and rinse. She has changed to a clean area to washcloth. Wash and rinse. Now she's going to pat dry. Coming back again now with the 4-corner techniques. She's going to remove the gown from one arm. Remember, for the state boards, we're only washing one arm because the state examiner is checking for technique.
I'm going to remove your towel.
Yes, she's removing the towel, and she's going to place that towel across the patient resident's chest to provide privacy. Now, for our washcloth, you're going to do soap, no soap, and soap. Soap, no soap, and soap. No soap. Now she's going to go under her towel and go wash, top of the hand, perfect. Now rinse. Once more time, again, wash, under, and rinse. Under. We're going to pat dry. We're going to assist the resident with turning to the side. I'm going to be her side rail. Come over, Mrs. Jones, very gently. We're going to turn our residents and make sure that they remain covered at all times. She's checking her basin of water to make sure the water is not cold or too soapy. The state examiner will check the temperature of the water. Again, for corner technique, soap, no soap, and soap. Mrs. Simon now is going to wash her back. Wash, rinse, wash, rinse. Now it's time for the back rub. Okay. Pat dry. Remember, we need to put lotion for our back rub, so Mrs. Simon is going to warm the lotion in her hand. In a swimming position, she's going to go 3 times up. 1, 2, 3. She's going to take the excess lotion with the towel off the resident's back. We're going to return the resident to her position, which is prone. Okay. And we're going to change the gown to a clean gown. Keeping the resident covered at all times. She's placing a clean gown on the resident, and she's keeping her covered at all times. All used towels and equipment will be placed in the dirty hamper. Yep, tie. She's going to tie the gown. So that's going in the dirty hamper. Any towels will go in the dirty hamper. She's going to make sure that our patient resident has her core light. We're going to return the bed to the lowest position. This is our core light. Put the bed down. We're going to ask our resident patient about any preferences, if she wants her curtain open or remain closed.
Open.
All right. We're going to use standard precaution and infectious control measures when providing care. We ask the resident about any comfort. We promote the resident's rights during the care, and we promote the resident's safety during care. She's now going to return all her equipment back to the bedside stand. Dry in the basin. That is a nightstand. Everything goes back where it belongs.
In the table.
At the end of the skill, she will say hand washing required. Cleaning off her table, putting everything back.
Close position.
Things will go in the trash. She would say hand washing required, and this is the end of the skill.